There is probably not one thing that a person can do for themselves besides quitting smoking if you're a smoker that is going to have a more positive impact on your life than exercise. We have a lot of drugs that you take may have 10 or 15 solid good studies behind them, that show positive benefit. We have hundreds on exercise, and these are high quality studies, these old studies, hundreds of them that have shown exercise to benefit multiple different conditions, areas of life, medical diagnoses, as far as treatment and prevention of those diagnoses. So I also want to start out as talking about something that exercise is probably least good at to kind of demonstrate the importance of it in other areas. Exercise is probably least good at actually weight loss, which is probably what everyone uses exercise for. It can help, and it's part of the overall approach to weight loss. In general, we'll kind of go on high blood pressure and diabetes, which are probably two of the most common conditions in America, especially in Mississippi. So high blood pressure in general, and we'll talk about amounts of exercise, but after what's considered probably a moderate intensity workout, you'll see an immediate reduction of your blood pressure. This can actually last for up to 24 hours after one single moderate intensity episode of working out. That alone over time can reduce your chance of heart attack by 9%, stroke by 14%, just that alone. And that's related to blood pressure, because we know blood pressure is a risk factor for heart attack and for stroke. But obviously, if it helps you lose weight, that can help too. All these things go hand in hand. Blood pressure and diabetes go hand in hand. So that's kind of because exercise hits so many different areas. Even if it doesn't directly help diabetes in this one way, because you're helping decreasing your blood pressure over here, it also further helps reduce your risk of diabetes as well. And it can be a treatment for diabetes too. So. We're really getting more and more information on that over the past 10 to 20 years of study. We've known for a long time about effects on blood pressure. But in general, as a lot of people are probably familiar, exercise does induce increased release of endorphins in your brain, which are kind of feel-good hormones. They also release or increase the release of serotonin in your brain. A lot of, for instance, antidepressants you take are basically trying to do the same thing. They're also trying to lead to higher levels of serotonin in your brain to kind of help balance you out. I think it's important to you just feel more accomplished. Some people might not get this sense, but most people, if they go out and they cycle for 30 minutes or they tell themselves they're going to do something and they do it, they just get a sense of accomplishment. Overall, that's going to kind of make you feel better about yourself in general, which can really help a lot with mental health as well. And then, like I said, it can also decrease rates of dementia substantially, which is going to obviously affect your mental health later on in life. Any individual who wants to get into exercise and who has not legitimately exercised in years, probably good to go ahead and talk to your doctor about it. Most people are going to be cleared to go ahead and start right off the bat. There are some people with specific heart conditions, maybe poorly controlled diabetes, that we might want to do a couple of other tests on first before we recommend moderate or vigorous exercise. We'll still probably end up recommending exercise to you, but we might want to kind of do some other evaluation first. And plus, your doctor a lot of times will be able to kind of help guide you on kind of specifically what to do, because and it depends on your goals as well. Because like I said, for instance, walking briskly 30 minutes a day is probably going to get you there. But if you want to do a triathlon, if you want to build muscle mass, or if you want to do something specifically, hack the Appalachian Trail, then you're going to need to tailor that. But for general health benefits, you don't really need to do any of that. So that's where it changes to. If you want to be healthy but also run a triathlon next year, then your training goals are going to be a little bit, and therapies are going to be a little bit different than someone else. But it's just going to come down to a discussion with you and yourself and your doctor as to what your goals are, how much time you have, are you going to have someone that you can do this with that might be beneficial to you, how's it going to fit into your day, and just what are you going to be able to keep up for the long term. We have a wealth of information today. Just find something, try to stick with it. If you can't do as far as you want to the first day, that is fine. You did it. If you did 5 minutes the first day, you did 5 minutes. Congratulate yourself on that, and try and get 6 minutes the next time. So talk to your doctor, your healthcare providers. We as a system, like I said, to reiterate, we have dietitians, we have personal trainers, we have physical therapists, we have great physicians and nurse practitioners, so we can really help you tailor that approach to get the best overall health benefit for you. So.